for tackling the COVID-19 backlog of elective care. Despite these exceptional efforts, there is now a considerable COVID backlog of elective care. 1,600 people have waited longer than a year for care before the pandemic. The latest data shows that this figure is now over 300,000. On top of this, the number of people waiting for elective care in England now stands at 6 million. That is up from 4.4 million before the pandemic.
But it falls seriously short of the scale of the challenge facing the NHS and the misery that is affecting millions of people stuck on record-high NHS waiting lists. We've been waiting some time for his plan to tackle NHS waiting times. We were told it would arrive before Christmas, we were told it would arrive yesterday, and it's not clear from his statement today that the delay was worth the wait. There's no plan to tackle the workforce crisis, no plan to deal with delayed discharges, and no hope of eliminating waits of more than a year before the general election in 2024. I wonder if they'll be putting that on their election leaflets, Mr. Speaker. The only big new idea seems to be a website that tells people they're waiting a long time, as if they didn't already know. So can the Health Secretary tell us which target he's aiming to meet? The target that hasn't been hit since 2015, or the target announced yesterday, which seems to lower standards for patients because they consistently fail to meet them? It seems the Secretary of State declared a war on cancer after more than a decade of disarming the NHS, and now he's sending them into battle empty-handed. For a plan to recover the NHS and bring down waiting lists that doesn't contain a workforce plan. The single biggest challenge facing the NHS is the workforce challenge. There are 93,000 staffing vacancies in the NHS today. It is understaffed, overworked, and if he's not careful, he will lose more people than he is able to recruit. So we know the NHS want a workforce plan, the public want a workforce plan, he promised a workforce plan, so where is it? Instead, he's proposing new NHS reservists. Who are they? Where are they coming from? How many does he imagine they will be? How does he imagine they'll make a dent in the 93,000 vacancies? It seems more Dad's Army than SAS.